Thank you.
Good morning, everyone. Good morning. Good morning. Welcome. Welcome.
And we're going to get the slides up on the screen.
Yes, I am right now. Let's see.
While you're doing that, I'll do an official welcome for everybody. Good morning. Happy Friday to you all. And thank you so much for being here today with us. It is our pleasure to present to you the 2025 to 2029 Older Americans Act State Plan on Aging. My name is Jamie Pope, and I am the section chief over the planning, monitoring, and data section here at CDA. We have quite an agenda to get through this morning and a couple of housekeeping items that I'll be going over with you as well. We're first going to start with those housekeeping items I'll mention in a second. Then we're going to move on to our welcoming remarks from our director, Susan Damaris. From there, we're going to move on to the state plan overview. That's kind of what goes into the construction of the state plan. That's going to be covered by Mark Beckley, our Chief Deputy Director here at CDA. Now we're going to talk about the goals and objectives themselves. That's kind of the meat and potatoes of the state plan. That's going to be presented by Dr. Nakia Thierry, our branch chief over our older adult programs branch. And then we'll move it back to Susan for some closing remarks before we move it to public comment at the end of our presentation today. So we'll go through just a couple of housekeeping items. This hearing is being recorded. There will be a public comment period at the end of today's presentation. Participants are currently muted until that public comment period begins. Closed captioning along with ASL is available. To make a public comment, you've got a couple of different options for you. You can use the chat feature down at the bottom towards the middle of your screen. That chat feature is very handy. Feel free to go ahead and just type your public comment into that chat feature. We'll make sure that it's captured. That's a nice handy feature if you're not too keen on raising your hand and vocalizing your public comment. But we have that feature too. So in order to raise your hand and vocalize your public comment, you're just going to use that raise hand feature at the bottom of your screen during the public comment period, and we'll make sure that we capture that. This presentation will be available at aging.ca.gov on our website or on our CDA YouTube channel following the conclusion of this presentation. And from here, I will go ahead and turn it over to our director, Susan, for our welcoming remarks. Thank you, Susan.
Great. Thank you, Jamie. Good morning, everybody. Happy Friday. Thank you, Jamie and team, for organizing today's webinar. And a huge thanks to our 90 participants joining us today. You're going to hear from us, but we really want to hear from you. That's the purpose of today's webinar. We're just really excited. Our team, I have a lot of people to thank. First and foremost, I want to thank our 33 area agencies on aging who developed their local area plans in conjunction with members of their community. So there are thousands of people around the state who informed the local area plans, and those area plans come up to the Department of Aging and inform this statewide plan that is in draft today. So what you're hearing today is a draft document. It is our best work. It is our best work reflective of the communities around the state. And we know it's not perfect, so that's why we want to hear from you today. I'm sure there are areas where we fell short. Maybe there are areas where we didn't emphasize or prioritize priorities for you. We want to hear that today on the webinar. And if you need time to digest the material, it's pretty dense today. We have a process through the end of till June 21st where you can comment online, so you can reflect back on this and share your comments with us online. You can also share this material with others who aren't joining us today to make sure they have an opportunity to contribute to California's state plan. We know from our prior state plan that planning matters and planning works. We're very proud of what we achieved together with our community partners, our AAAs, our aging network statewide in the past 4 years. And we're committed to doing more in the next 4 years. And without a plan, things may not happen. We have another plan in our state. Many of you know California's Master Plan for Aging that has been a North Star, a guiding light, and a compass for our state. It's a 10-year blueprint for our state. This is for the next 4 years. So we're looking forward from 25 to 29. And this plan, when it's approved, when it's submitted to the federal government, and you'll hear more about that process, it will inform our work, and it will inform our work at the state level, at the regional level, and at the local level. So today, very, very important that we hear your voices, your comments, and we will take it all back. We will integrate and incorporate it wherever and to the best of our ability, wherever we can. And with that, I want to turn it over to Mark Beckley, our Chief Deputy, who will talk to you about why we're gathered today and what this all means for you and for your community and for the state of California. Mark.
Great. Thank you so much, Susan. And it's so great to be here with all of you today. Next slide. So I'll provide some background on the Older Americans Act and the development of the state plan, and then kind of walk you through why and how this plan will be used to really serve all populations, so older adults, persons with disabilities, and caregivers throughout the state. So each year, the federal government allocates millions of dollars in funding to California to administer programs authorized under the Federal Older Americans Act. These programs provide a variety of services and supports to older adults, caregivers throughout the state, including meals, health and wellness training, caregiver support, and legal services. In order to receive funding, California must submit the state plan on aging to the federal government once every 4 years. The state plan includes information about the state's goals and objectives for the Older Americans Act programs for the next 4 years. Our next state plan year begins October 1st, 2025, which is the beginning of the next federal fiscal year. Next slide. The federal government requires states to inform its state plan from a variety of key sources and meet the following requirements. First is to collect feedback from the public, including surveys and needs assessments. The second is to provide feedback from area agencies on aging, their plans and goals, and their local area plans. Third, provide input or obtain input through a public comment period, which we're in currently. And then finally, provide assurances to the federal government that the goals and objectives that have been established in the plan meet federal requirements. Next slide. So CDA drew on a variety of sources to inform its state plan. So I'll go over a few of these sources. The first is the local area plans that are developed by our 33 local area agencies on aging. These plans are developed once every 4 years, and these are informed by the needs identified in their communities through surveys and through public hearings. Second is federal and statutory and regulatory requirements. Third is the governor's master plan for aging. We're so proud to now be in the 4th year of our master plan for aging, and we've made really great progress on enhancing programs and services that serve older adults, persons with disabilities, and caregivers throughout the state. The plan is also informed by our CDA strategic plan. This plan is developed, again, similar to the state plan, once every 4 years. So we just developed and released our latest 4-year plan in January, and that is available on our website if you'd like to view it. And then finally, through a public feedback period, So like I said, we are in this period right now. To collect public feedback, we're hosting 3 of these public forums, and then we'll have a survey available on our website until June 21st. So if after this webinar you think of additional information you'd like to get from the plan or critical needs that should be incorporated that we may have missed, that would be your opportunity to do so. Next slide. Okay, so now I'd like to highlight what you should not expect to see in the plan. So the plan, as I stated, is really focused on the Older Americans Act programs that are administered by our local area agencies on aging. We do reference some additional programs and services that they do offer. And some of these services would include services such as our HICAP program, which is our health insurance counseling or Medicare counseling, CalFresh Healthy Living, caregiver resources, and the Office of the State Long-Term Care Patient Representative. Programs that you will not see referenced in this plan would include in-home supportive services, adult protective services, and other health programs. These are administered by other departments, and they have their own federal reporting requirements for those programs. However, we do want to note that these programs are addressed in our state master plan for aging. And the master plan for aging is the state's comprehensive blueprint to improve, enhance, and expand services for older adults throughout the state in the areas of housing, healthcare, equity and inclusion, caregiving, and affordability. And you can learn more about our MPA through our website, mpa.aging.ca.gov. Next slide. Okay, so I'd like to cover what the California Department of Aging's role is in administering the Older Americans Act. So the California Department of Aging is responsible for allocating funding to our local partners, our local area agencies on aging. There's 33 area agencies on aging that provide services to all Californians throughout the state. So we oversee and provide monitoring and support to the AAAs to ensure that they're able to effectively deliver these services. And I'd like to briefly cover some of the services. This is not comprehensive. There's several tremendous services that our AAAs provide, but these include congregate and home delivered meals, caregiver support, disease prevention, health promotion and Medicare counseling, elder abuse prevention, and advocacy for individuals in long-term care facilities. That's provided through our state long-term care ombudsman program. Next slide. Okay. In terms of CDA's role and responsibility in preparing the state plan, we do this collaboratively with our Health and Human Services Agency, and we do provide leadership and oversight, as I mentioned previously, to the Older Americans Act programs and to our local area agencies on aging. The overall vision for our state plan is to offer a broad variety of programs and services that further support age and ability inclusive programs to all Californians, that empowers them with choice to make decisions that best suit their needs and their circumstances. And we do this through partnerships, advocacy, and outreach efforts. Next slide. Okay, so that is an overview of the state plan. We always like to include the following slides that talk about why these plans are so important and why they become increasingly important for us to really develop and continue to expand over the years. These are slides that show the demographics of the older adult population in the state. And this first slide really shows the age ranges of Californians and how they're expected to grow by 2040. So we see that the older adult populations do experience the greatest growth. By 2040, that range anywhere from 12% to 138%. And we see that populations 40 and younger are actually seeing growth declines in the state. Next slide. This slide I really love to highlight because our research unit put so much time and effort in developing these local county profiles. These county profiles show the demographic information about older adults in each county in California. This information includes the age ranges of older adults, race and ethnicity information, growth rates, and key needs around certain factors such as poverty, social isolation, housing, and language access. These profiles are really instrumental to help inform our local programs about the needs and service gaps for the populations they serve. Next slide. Okay, this next slide, again, just accentuates the growth trends in the state for older adult populations. So I showed the slide that showed the age range growth and older adults experiencing the greatest growth in the state. This shows that this is a statewide phenomena. So we can see that from 1980 to 2060, the growth in older adult populations throughout the state are growing. All arrows point up, and those range in growth by region by anywhere from 125% to 428%. All right, next slide. And this final slide really shows a lot of the same information, except this provides raw numbers of older adult growth rates up to 2040. And we see the largest increases in growth in the 75 to 79 age range category, as well as the 80 to 84, with growths of 876,000 to 855,000. So thank you for allowing me to provide this overview, and I will now hand it to Dr. Nakia Theory, who will go over the components of our state plan. Nakia.
Thank you very much, Mark, and good morning, everyone. I hope everyone is having a lovely day today. We are going to now cover our Older American Act State Plan goals and objectives. As Mark, as well as Susan has stated, these goals and objectives were developed out of staff review and recommendations over the course of the last 4-year state plan, as well as a large contributing factor being the local level area plans that were submitted to the California Department of Aging for our review and execution at the local level. So we were privileged to be able to receive all 33 AAA's 4-year area plans from them. And through that, we had an opportunity to review and reflect and to incorporate many of their goals and objectives, as well as strategies and outcomes into the development of our OAA state plan goals and objectives. We've also pulled from information via our strategic plan, our MPA, and we are very happy to be able to present to you today the state plan goals and objectives. Now, while this particular portion of the presentation will be limited to the goals and objectives, I did want to mention that within the actual OA, is everyone hearing me okay? Okay. Looks like we lost feed. That is Zoom for you, but we are going to jump right back on in. I am going to share out my screen again, and we will go ahead and get started since everyone is hearing me okay now. Is everyone seeing the screen? Yes, thank you, Rex. All righty. So we are going to go ahead and start everything right back up. So again, I am going to start at our state plan goals and objectives with the very first objective, the very first goal for our 2025-2029 OAA state plan. Goal 1 is to enhance outreach, information, and assistance. CDA will increase public visibility, raise awareness, foster engagement, and promote education for older adults, people with disabilities, and family caregivers, with focused attention on those with greatest social and economic need. There are several objectives within this particular goal. The very first objective is to increase public awareness of aging services through targeted outreach. The second objective within this particular goal is to establish a statewide aging and disability no wrong door system, building a statewide service provider directory to provide person-centered navigation services to connect older adults, people with disabilities, family members, and caregivers to a wide range of long-term services and supports and other services all in one place. So this would be considered like a one-stop shop approach. The third objective within this goal is to modernize the health insurance counseling and advocacy program to ensure Medicare eligible Californians receive the insurance counseling they need and successfully enroll in health insurance plans of their choice. The fourth objective within this goal is to increase awareness and outreach to family caregivers by aligning program outreach efforts with the actions under Goal 1 found within the 2022 National Strategy to Support Family Caregivers. Objective number 5 within this particular goal is to improve emergency preparedness through a learning community that exchanges information, including training, resources, and best practices to prepare for disasters before they happen, to remain safe during the disaster, and to aid in recovery efforts after disasters occur, which is so important, especially over the last year or so with all the emergencies and disasters that we've experienced here in the state of California. Then we have objective number 6 under this particular goal, which is to promote the role and importance of the long-term care ombudsman program to help residents, families, and chosen support people understand how the LTCO representatives can assist the public. And then we have objective 7 within this goal, which is to provide language access and Americans with Disabilities Act accessible programs and services with translation of all vital documents that will be housed on CDA's website. Now we will go into covering goal number 2 of our state plan. And goal number 2 is to increase opportunities to age in place in home and community-based settings. CDA has supported and will continue to support the ability of older adults and people with disabilities to age in the setting of their choice by expanding access to health and supportive services, nutrition, and family caregiver support. And I just wanted to mention that these are all programs that we are currently already providing within CDA that are implemented and executed through our 33 AAAs. The first objective within goal number 2 is to strengthen OAA in-home services across the aging network through the delivery of person-centered services for eligible Californians. Objective 2 is to improve the health and well-being of older adults by increasing access to congregate and home-delivered meals, nutrition counseling, and education and food assistance programs. And the third objective within this goal is to improve the health and well-being of older adults by increasing access to health promotion programs and services. The objective number 4 is to coordinate efforts between the Family Caregiver Support Program and local partners to strengthen and expand accessibility of supportive services and resources that are person-centered for both the family caregiver and the care recipient, and that align with the actions under goals 2 and 3 found within the 2022 National Strategy to Support Family Caregivers. The fifth objective within this goal is to strengthen leadership in the home and community living network. We will now go into state plan goal number 3, which is to prevent isolation, promote inclusion, and advocate for elder justice. CDA will seek to combat loneliness and isolation with policies and programs which ensure accessibility for all, including vulnerable populations that are at risk of fraud, abuse, neglect, and exploitation. The first objective within this goal is to expand access to OAA Title IIIB legal assistance services to ensure that more older Californians have access to a legal services program to protect rights and secure justice. The second objective is to improve the long-term care ombudsman program's capacity to respond to concerns made by or on behalf of long-term care residents. The third objective is to promote strategies to reduce and prevent fraud, abuse, neglect, and exploitation of older adults and to advocate for elder justice. The fourth objective is to support the behavioral health needs of older adults, adults with disabilities, and family caregivers in partnership with the Department of Healthcare Services, the Department of Public Health, the Department of Healthcare Access and Information, and behavioral health stakeholders throughout California. Our fourth goal of the state plan is to strengthen partnerships. CDA will enhance communication and increase engagement with key stakeholders, including our area agencies on aging, county governments, tribal organizations, faith leaders, policymakers, community-based organizations, and healthcare providers. The first objective within this goal is to encourage and support local jurisdictions to develop, implement, and evaluate community-led local master plans for aging. The second objective is to expand access to Older Americans Act programs and services for Native American, Alaska Native residents, and tribal organizations. The third objective within Goal 4 is to facilitate coordination with county services, including the Medicaid eligibility determination, adult protective services, in-home supportive services, housing and homelessness services, the Public Guardian/Conservators Program, Emergency Disaster Response Services, and Veteran Services, just to name a few, to support streamlined access to coordinated services and better outcomes for older adults, persons with disabilities, and family caregivers. Now we will go into Goal 5, which is to advance strategies to improve financial security and economic support. CDA will improve financial security and increase economic support for older adults, persons with disabilities, and family caregivers by identifying employment opportunities, assisting with navigation of coverage and benefits, and removing barriers to access. The first objective within Goal 5 is to increase financial security and economic support for older adults. The second objective within Goal 5 is to assist Medicare beneficiaries with education and application completion through the California Medicare Improvements for Patients and Providers Act, also known as MIPA project, to improve access to the low-income subsidy, also known as LIS program, for Medicare Part D, Medicare Savings Programs, also known as MSP, and Medicare Preventive Services. And finally, we arrive to Goal 6. And Goal 6 of the state plan is to support aging services providers statewide. CDA will equip aging services providers statewide with enhanced tools, trainings, and technical assistance to continue to deliver quality services to older adults, persons with disabilities, and family caregivers. The first objective within Goal 6 is to explore partnerships involving healthcare plans, long-term services and supports providers, government programs, and other health entities. The second objective is to develop supportive services programs and tools which enhance the quality of aging programs and aging provider services delivery, especially in areas of greatest social and economic need. The third objective is to streamline CDA's planning, monitoring, program operations, and fiscal processes related to area agencies on aging and the network of community providers. The fourth objective is to upgrade and integrate technology and data for action and performance. And the fifth objective within Goal 6 is to strengthen and support alignment between state and local aging providers to achieve person-centered, data-driven, equity-focused outcomes for the growing and diverse population of older adults, people with disabilities, and family caregivers in California. So as you can see, we have a lot of work to do over the next 4-year cycle, and CDA is committed to executing everything that we have indicated and to looking forward to making California a wonderful place to grow in age and to develop. And we are committed to the goals and objectives that are outlined within our state plan. I will now pass it over to our director, Susan, who is going to deliver our closing remarks. Susan?
All right. Great. Thank you, Dr. Theory. Thank you for walking us through that. And again, I want to thank all of our local partners, starting with the community members who showed up for local town hall meetings to inform their local area agencies on aging, and that was rolled up into the local area plans. I hope you saw reflected in the goals and objectives, the highest priorities in your community, what matters to you personally. And if you didn't, please let us know that here. I want to thank our CDA staff, all of our AAAs for submitting their local area plans, and for our community, all of our community members who have informed the draft and who are going to continue to inform it through June 21st, our cutoff date for public comment. I also wanted to just touch very briefly, goal number 1 is about increasing awareness and information and assistance. We have some resources that if you're joining us and you're not yet familiar with them, we want to share California's Aging Resource Guide, available in 7 languages, and also our Disaster Planning and Preparedness Guide, also available in 7 languages. We may be, this may be a new audience, and we want to make sure everyone knows that those resources exist for you and your community partners. Also, I want to highlight that this Sunday evening, there will be a special on ABC across the state in many communities, and I can tell you which ones, but following the NBA finals, there will be a televised special on ABC talking about aging in California. And that will show up in lots of parts of our state, including Bakersfield, Chico, Eureka, Fresno, Los Angeles, Monterey, Salinas, Palm Springs, Sacramento, San Diego, San Francisco, and the Santa Barbara, Santa Maria area. So when Dr. Theory said we're committed to seeing this through and to achieving all of the goals and objectives, we're not waiting for the plan to be approved either. We're starting now, and the work continues, and we're doing it with all of you in partnership and in collaboration. So thank you again for joining. Now the good part of the webinar starts, where we get to hear from all of you. So I turn it over to Denise Leiker, our Deputy Director, who will facilitate public comment. Denise.
Hi, thank you, Susan, and welcome everyone. We are now going to stop talking, and it is time for us to hear from you. So how our public comment will work on this webinar is we have 2 opportunities to be able to submit your comments. First, you can, if you'd like, type into the chat. Those are going directly, your questions and comments are going directly to the panelists so that we can take those back in writing. And for those of you that would like to speak, please raise your hand using the feature on the bottom toolbar of the Zoom. And when I call on you, you'll be able to speak and unmute yourself in order to be able to make comments of your observations regarding the plan and any suggestions and ideas that you want to share with us. I do ask that you please try to keep your comments to 2 minutes. I will be using a timer if we have a lot of participants. So please, you might hear a noise in the background when that 2 minutes happens. And at that point, would love to have you wrap up your comments. And all of your comments will be taken back for us to use as we finalize this plan for submission. So at this time, if you would like to make a comment, please raise your hand.
So I am going to stop sharing, Denise, so that I can better see the public comments.
Sounds
And
great.
I am now going to also allow participants to unmute themselves once we call on them from the raised hand
Thank you.
portion of this. So I do see that we have several participants that have their hands raised. Do you just want me to go down the list, Denise, or how would you like us to do
Yes,
this?
I can't actually see that on my screen, Nikita. So if you can call them out, that would be great. Thank you.
Okay. So the first we have is Stephen Spano, and please forgive me if I say your name incorrectly. Again, Stephen Spano, feel free to unmute yourself and give your public comment.
I think he's still struggling to unmute. It looks like.
You are unmuted on my end, Stephen. You should be able to speak.
Did you unmute? Oh,
There you go.
There you
You're
are.
unmuted.
Welcome.
We did hear you, Stephen. If you wanted to continue to
Yeah.
talk, you are unmuted.
so this is Bill Hirsch, who raised my hand. Stephen is a colleague. Can you hear me?
Yes.
Yes, we can.
Please go ahead.
Okay, thank you. So my name is Bill Hirsch. I served as the director of the AIDS Legal Referral Panel, which provides legal services to people living with HIV and AIDS. I am appreciative of the opportunity to provide comment and thank you for all the work that you've done to move this process forward. Of particular concern is that there is not enough of a mention of the service needs of long-term survivors who are living with HIV. These are folks who have been living with the disease for more than 30 years, and increasingly the percentage of people living with HIV in San Francisco, but throughout the state, are over 50. And I think at this point, a majority are over 60. So we wanted to see more detail in how the plan was going to address those needs. These are people who have lived with long-term trauma, much described as post-traumatic stress disorder. They've lost all their networks of support as their friends and family have passed. And the other thing I would mention is that housing needs to be specifically addressed. Oftentimes, state and local departments act in a vacuum and don't recognize how critical the linchpin of housing is to address the health of vulnerable communities. And if people don't have stable, affordable housing, there's no way that they're going to be able to access the other services that they need. There have been a number of strategies to help to support folks so that they can live independently, including providing community placements as well as housing subsidies so that people who are in long-term units can remain in those units. So thanks for the opportunity.
Thank you for being here today, and thank you for your comment.
The next person we have with their hand raised is Catherine McPherson. Catherine, feel free to unmute yourself. You are unmuted now, Catherine. We can hear you if you wanted to go ahead and speak. Catherine? Catherine, you are unmuted if you wanted to move forward with speaking. Okay. I'm not hearing Catherine, so we're going to
The
go
next person.
down to next person, which is Jeanette Diaz. Jeanette,
Hello, my name's Jeanette Diaz. Can you hear me?
yes, we can.
Yes, we can.
Thank you. I'm calling in from Costa Mesa. I am a registered dental hygienist in alternative practice, and I've gone through this plan. I love the work that's been done. I'm proud to be, from California to be able to really prioritize the needs of our older adults. And as a dental hygienist who sees older adults and people with disabilities, the oral health of these populations is something that I see that often gets forgotten. I believe that really I would love to see a little more on expansion on what health looks like. So I know that this master plan is a little broad, but I would love to see as it unfolds to see an objective that really speaks to the importance of the oral health of our older adults. Oral health is linked to many chronic health conditions. We also know that it affects quality of life. I see that we have areas where we're really trying to support our older adults' ability to eat, receive nutritious foods. And without good oral health, many older adults don't even have their teeth, have lost their teeth, don't even have dentures. So without a focus on oral health, I think that we're not going to be able to fully support the needs of our older adults. So I would love to see um, a little more on this topic. And I understand, CDA is not the agency in charge of funding these services, but I believe that you play a big role in the health promotion awareness of the services that are available, not just in a dental office, but portable services as older adults choose to age in place wherever they like. They can also receive services in their homes. So again, my name is Janet Diaz. I'm a registered dental hygienist in alternative practice, and I would love to see more on oral health as a priority for our older adults in California. Thank you.
Thank you, Jeanette.
I'm going to go back to Catherine McPherson to see if she's able to speak now. Catherine, you are unmuted if you wanted to go ahead and speak. Okay, still not hearing Catherine. I am going to go forward to Vincent
Oh,
Crisatomo.
I see. It's Catherine Hetzer, not been.
I have two Catherines.
Yeah.
Catherine Hitzer, I do see you as well, but I'm going to go to Vincent. He's had his hand up first.
Okay.
Vincent Crisatomo.
Good morning. Can you hear me?
Yes, we can.
Yes.
Okay. My name is Vince Chrysostomo. I live in San Francisco, and I am also a member of the Equity and Advisory Committee on Aging and Disability to the California Master Plan. I'm following up from Bill Hirsch's comments earlier, and that is that programs and services for older people with HIV need to be included and funded in the California Department of Aging plan, the California Department of Aging plans. People with HIV are living longer due to effective treatment that was introduced. Today in the US, over 50% of people living with HIV are over the age of 50. In California, it's close to 60%. In San Francisco, it's 74% of older people living with HIV are over the age of 50. I will also be submitting this written because I'm going to go through it really fast so I don't go over the 2-minute limit. Bill talked about characteristics of the population, but I also wanted to bring to attention the California HIV and Aging Act, which was signed into law back in 2021. And that did update section, it's SB 258. It updated section 915, which actually lists HIV status, gender identity, or gender expression has populations and characteristics of greatest social need. I will submit this also via writing, but I just wanted to put that on record. And, we are 40-something years into the pandemic. People think HIV, AIDS is over. It is not, and it disproportionately affects older people. In addition to what I've already stated, a disproportionate number of older people are also diagnosed, meaning after the age of 50, like through divorce, becoming widowed, or whatever, separated, that we're also seeing a higher percentage of that as well. And so California is one of only 2 states that have an HIV and Aging Act. Illinois is the other one. So I think it's high time that we put this in and that our people, our communities are getting served. Thank you very much.
Thank you, Vincent.
Next, we are going to have Catherine Hetzer. Catherine.
I'm here and
Please.
hopefully my dog will not bark. Okay, so I work in Los Angeles area right now, and I do work with a lot of seniors. The housing that they need is critical. The Home Safe program I heard is being salvaged for at least another year, which I'm grateful that those clients who were lucky enough to be on that program will continue. However, daily, and I mean daily, I get phone calls from seniors who are experiencing the same sorts of problems. Their incomes do not match the rent increases that they're receiving of over $100, $150 a year. As these go up, they are falling into critical situations where they just cannot afford. I think since this goes to federal, that we really need to work with create a partnership with the federal to subsidize or something so that we don't have all of these seniors that we're going to be getting falling into homelessness. We just can't, the homeless side of things is trying to prevent it as best they can, but there's only so much we can do with the funding we have as far as homeless service providers as well. So this is a major, major issue that I think really needs to be looked at and from all angles and kind of come up with a way maybe to get them vouchers, some kind of streamlined vouchers for seniors that can work through federal. Thank you.
Thank you, Catherine.
So we now have, I want to get back really quickly because Catherine McPherson did write in the chat that she's calling from her phone now. So we should be able to hear Catherine McPherson. So Catherine, you are unmuted. Catherine McPherson, you can speak at this point.
Great. Can you hear me now?
Yes, we can.
Oh, good. So happy. Thank you. I'm Catherine McPherson, a registered dietitian nutritionist and Senior Vice President and Chief Nutrition Officer for Mom's Meals. And we applaud the work of the Department of Aging on the state plan. And thanks for the opportunity to offer a few comments. So as a provider of food as medicine solutions, including high quality, medically tailored meals delivered to the home to Californians and nationwide for more than 20 years, our comments are based on our deep expertise in providing nutrition services. First of all, we're very excited to see that the Department of Aging would like to expand access to RD counseling within the population of OAA, HCBS, and LTSS meal recipients in California. RDs are the nutrition experts who not only assess for nutrition risk, but help co-create plans for healthy eating for individuals. We're also very excited to read that there will be an increased focus on Title III C2 meals that can be taken home for consumption. This provides more options and flexibility and choice to seniors, which is so important. Our comment is to enhance this choice and ensure that home delivered medically tailored meals that are prepared with high quality nutritional ingredients and also food safety oversight are available. So our suggestion is broadening new partners beyond restaurants to include or focus on medically tailored meals providers as well. Medically tailored meals providers like Mom's Meals have menus developed by registered dietitians, nutritional content that meets dietary guidelines for Americans, 1/3 of daily needs for seniors with regard to nutrients. And also they adhere to guidelines for the management of chronic conditions that are so common among seniors. Partners like Mom's Meals with multiple food preparation, fulfillment, and distribution locations across the state. We have that variety of geographies. We can really help AAAs build out their disaster preparedness planning as well. That's also called for in the state plan. This ensures that meals can be provided in a local area that might include restaurants or local meal providers are impacted by weather or other events. And disaster planning can be further supported with shelf-stable meals that Mom's Meals and other providers offer as well. Next, Mom's Meals would like to call attention to the current limited availability of home delivered meals to the vulnerable HCBS and LTSS populations. I know that was touched on in the comments. So we're excited to see that.
Catherine, can I ask for you to please wrap up? We're past 2 minutes.
Yeah. So I just wanted to call out that we would be very pleased to partner with organizations and AAAs to execute on the plan, and also work to ensure that there's broad awareness of the meals available in the California Community Supports Program today. Mom partner for those, but it's an opportunity to get meals immediately to seniors.
Thank you, Catherine.
Medi-Cal. Thank you so much.
Thank you. Thanks for being here today.
Thank you. We're going to go in this next order for those who have had their hands raised for a bit of time now. So the first will be Nina Weiler Harwell, and then Maggie Kraft after that, and then Kiera Pollock. So Nina, you are unmuted and able to speak at this time. Nina?
Can you hear me?
Yes, we can.
Great. Thank you. So good morning. Appreciate the advocacy of other folks on the call. And thank you for pronouncing my name correctly. I did want to raise up just a couple of things. Very excited about the focus on emergency preparedness, and looking forward to seeing how we can partner with CDA on this, because we know the impact of these emergencies on older Californians, especially extreme heat, but as well as the LA fires, the most frequent, or sadly, the older Californians are more likely to be victims of these disasters than younger Californians. I do have a quick question that has to do with housing and transportation. I was trying to align my comments with the areas of the master plan. At this point in time, is it fair to say that transportation services are provided consistently across the AAAs, or is that still a work in progress? Can also put that in our letter. And same with housing services. I guess you can't answer a question now, so if you could, that would be great, but I would like to get some information on how consistent those two services are.
Hi, Nina. We're only taking public comment at this point, and so any questions you'd like to submit, then we can follow up with you in the future. And was that everything, Nina?
That is it. Thank you.
Perfect. Thanks so much, and thank you for being here today.
Next, we have Maggie Kraft. Maggie?
Yes, hi there. Can you hear me? Yes, it looks like you can.
Yes.
Hi, I'm Maggie Kraft. I'm the Executive Director with Area 1 Agency on Aging, and up serving Humboldt and Del Norte counties, and I've been working in older American services directly as a provider, but also now as an area agency representative since 1986. I will be providing more written comments. I know there's not a lot of time here, but I just wanted to mention that at this point, many of these objectives don't seem particularly measurable as they're written, but more specifically, I think it's also important to define some terms. Maybe you can add these to your document in terms that, because we all use some of these terms differently. For example, I see that access is used a lot. AAAs define access maybe a little differently than Department of Aging does. And we look at availability as well, and availability depends on funding. And so there can't be access to these services without the ability to fund them and hire professionals to provide the services and pay for the rising costs of food for our providers, also transportation costs, et cetera. We don't necessarily have an access problem so much as we have a funding problem. And we don't need more technical assistance out here in the field as much as we need the funding to provide what we already know how to do, and to meet the unmet needs that we already identify every year in our area plans. So while this state plan has a lot of information in it, I just caution against talking as if all these things might be able to be fixed simply by improving, quote, access. Access does not exist without funding. And the AAAs throughout the state are working very hard to do what they can with the limited amount of resources we have, in addition to the requirements from the state and federal levels for reporting and data. So I just wanted to mention those things, and I'll provide other comments later. Thank you.
Thank you, Maggie.
Next, we will have Kiera Pollock, and then we will have Regina Sneed, and we'll go back to Stephen Spano, who has another comment. Kiera?
Hi there, can you hear me?
Yes, we can.
Great. My name is Kira Pollock. I'm Director of Senior Services at the Los Angeles LGBT Center. We support our older adult population, age 50 and older, who identifies LGBTQIA, as well as HIV positive in Los Angeles. We are part of the older adult system of care in the city of Los Angeles as part of a mini multi-purpose senior center that we operate here in Hollywood. I'm reaching out today to really talk through both first thanking CDA for the work that it's done on really identifying the needs of LGBT older adults through the needs assessment that you all supported in the last year and the findings around that. But looking at the future, knowing that our community is particularly under attack, and particularly by the federal government, and knowing that the needs of LGBTQ older adults and HIV positive older adults are really at need under this current administration. While I know where we are in the fiscal year right now, my hope would be that CDA could look at the priority areas in both the master plan on aging and the needs assessment that was done recently to look at ways that we could maybe collectively with communities organize to advocate for additional dollars at the state level to help support LGBT and HIV positive organizations across the state with a demonstration project around supporting those needs and funding those services outside of the system of care that exists already. Thank you so much.
Thank you, Kara. Thank you for your comments and for being here today. Next.
Next, we have Regina Sneed. Regina, you are able to speak at this time.
Okay, can you hear me?
Yes, we can.
Great. My name is Regina Sneed. I'm a retired attorney who did a lot of work in disability law. I just thought I would make a few comments listening in today. One is that I'm fortunate to live in a continuing care community in San Francisco for seniors, so a lot of my needs are met. But I'm very pleased that the state has put a lot of emphasis in having a statewide plan. And I've been following it for the last 8 years in its development. I would like to mention a couple of things that are of particular importance to my community, and that is emergency planning. We certainly learned some things during the fires about evacuation of people and inadequate resources to do that for even people in a CCRC that are a better off community than most. The other program that I really support strongly is HICAP. Even though we're, kind of sophisticated group living here, we still need to have access to somebody who can really explain Medicare programs in an unbiased source. So I want to commend you on putting resources there. And I also want to support the comments made by Bill Hirsch and his colleague from the AIDS referral panel. I've worked with them over the years on things. We do need more emphasis on AIDS resources now, particularly with the cuts in the federal budget. And finally, I would just like to support very strongly your, I think it's goal 1, which is about outreach to communities. This probably is the most significant and important thing to do, in my opinion. It's like repeat, like with real estate, location, location, location. At our age, we need to hear things frequently and until they sink in. So I really applaud you for making that one of your primary goals. Thanks for the opportunity to speak.
Thank you for being here today.
And next we have Stephen Spano. Stephen, you are unmuted and able to speak at this time.
Thank you very much. Sorry for my earlier technical difficulties. My name is Stephen Spano. I'm an attorney at the AIDS Legal Referral Panel. You earlier heard from a colleague of mine. You know, I grew up in New Jersey. I remember going to a family affair at some point, and I asked about an Uncle Frank that I had some big memory of, and the response was, "Oh, Frank, he moved to California." And I understood that kind of intuitively to be a euphemism, that if I wanted to be myself, I'd have to relocate here. And I've now been here for over 20 years. I'm working with the population, and unfortunately, by the time I got here, a lot of our elders had been, affected pretty heavily by the AIDS, epidemic. And those of my elders that are living are affected heavily by trauma and isolation. And I would really like to advocate that this plan address the specific needs of LGBTQIA elders, as well as people living with HIV. Long-term survivors are a rare bird, and they have been enriching the community for a really long time. There's no specific discussion about mental health and support for people living with HIV, a significant portion of whom are eligible for a lot of these services, but often either don't hear from them or are unable to access them, or they're underfunded and unmet by the existing CDOs. So I would encourage the plan to adopt policies that work with CDOs who already provide culturally competent care to this population, many of whom are multiply marginalized. And I really appreciate the commitment of the agency to keep the population alive and see us where we are not being seen elsewhere. And I appreciate all the other speakers here. Thank you.
Thank you, Stephen.
Thank you. There are no other raised hands at this time, Denise.
Okay, so as we begin to wind down, if you would still like to make a public comment, you can please raise your hand using the raised hand feature at the bottom on the toolbar of your Zoom screen. We are tracking in our chat. I want to acknowledge that we have received comments around transportation and more comments about integrated transportation. We've received more comments about partnerships and how we can strengthen those. We also have received comments around housing and assistance in bolstering the assistance for housing for our older adult population. We have also received comments regarding seeking some clarification around federal funding, which we will have more of as a department once the budget process has concluded in Washington. We have also about state budget, which also would be more to come after the governor has and the legislature has concluded that process. We had some recognition of the conversation around dental and oral hygiene needs for our older adults and some comments there. And also there is comments here regarding nutrition as well. So a lot of the things that have been spoken have also come through in our chat. And I did notice that we did have some information put in our Q&A instead of our chat. We will move that over to our chat to be able to capture all of the comments from this webinar. But thank you very much, everybody, for your input here. I am
Denise?
double checking. Do we have any more hands raised? Yes.
We
Thanks.
do. So Will Tift has raised his hand. Will,
Okay.
you are unmuted and able to speak at this time.
Good morning. Are you able to hear me okay?
Yes, we can.
Yes, we can.
Yeah, Will Tift, planner, Area 4 Agency on Aging in the Sacramento region. Just wanted to add that under the current administration in Washington, also very clearly under attack are immigrant communities and non-English speaking folks. And so, those are for older people. Those are among the most vulnerable and isolated individuals that we serve. And so just think that's important to share and be cognizant of, that it's very difficult for individuals to learn a new language if they've, immigrated here from another country late in life, and in addition to cultural barriers and obviously, fear in terms of, immigration status. And so to the extent that all of that is even harder than it was prior to various executive orders, I think added emphasis is needed there, as our California older population is increasingly diverse. Thanks.
Thank you, Will. Do we have anybody else that would like to speak today?
Yes, Denise, we have Francisco, excuse me, Alina Francisco, who just raised her hand. Alina, you are able to speak.
Hi, can you hear me?
Yes, we can.
Great, thank you. Thank you for giving me the time. I was going to I was not going to say anything, but there's still time. I wanted to mention, this was really great to hear all of the points and your objectives and goals for California. And I wanted to offer this, I'm also an RDHAP, or a registered dental hygienist in alternative practice. And I know there are many of us in California, not enough, because our aging population is outracing everything that we do in California. But sorry, I'm going to throw Jeanette Diaz under the bus, but the two of us are among many RDHAPs who would like to offer our services to be available to answer questions and to help expand dental hygiene care into the communities, and why we are why we talk about dental hygiene care. It's because we know it's not an afterthought. It's different from dental care. It's different from what dentists do. And of course we work together, but we need to have people that are aging. And I'm reminded of the people with HIV who are living with HIV. People who are aging and trying to age in place need to be able to have the services of us to come to their homes, and among many of the services that podiatrists and physical therapists and dental hygienists can go to these people who are living at home and aging in place. But please keep our names in the queue, and let us help you find a way to add dental hygiene care to the master plan for aging. And I know the goals are very broad in this that we've talked about today, but I just wanted to put that out there. Thank you very much for letting me speak.
Thank you, Elena. Thank you for being here today.
There are no other hands raised at this time.
Okay. I'm going to call for last call for public comment. So if you could raise your hand if you would like to make a public comment. Okay, hearing none. Nikia, can you bring the slide deck back up so we can go over the closing slides? And then, and in the comment in the chat, we did see some comments on senior centers. So those are noted. We're taking those back as well. So Thank you so much to all of you for being here today. For those of you that submitted comments in the chat, for those of you that raised your hand to speak live, we can't thank you enough, because it's very important that we hear from all of you and your opinions count. And so this conversation here on this webinar is not the end of the ability to provide comments on the state plan in terms of things that recommendations, items you think that are missed, things you think we did well. And on your screen here is the website page to go to in order to make formal comments in writing. Please know that any verbal comments made today and anything put in the chat, we are recording. But if you'd like to also comment through our channels, there is a survey there on the CDA website that you can fill out about the state plan. This survey will be open until June 21st. That is the day that our 30-day comment period will close. And that we will take all feedback that we have received and work on our finalization of our draft that we will be submitting to the federal government for their consideration. So please take this down. These slides will be posted after the webinar, and so you will be able to also find these slides as well. But I can't thank you enough in terms of being here today. If you would like to stay engaged with the California Department of Aging on our news year-round, there is a QR code on your screen that you can, with your smartphone, take you right to the link in order to sign up for our digital newsletter, so that you can keep up to date on things that are happening around the California Department of Aging. And with that, thank you so much to everybody here. Thank you to our team for facilitating this. And we look forward to hearing more from you through our website and comments. And we then will be releasing our final once it is approved. So thank you again. And with that, we'll adjourn our meeting. Have a wonderful day and a wonderful weekend.